Welcome again to SYNLAB podcast. We have been discussing about systemic lupus erythematosus. My name is Patsy Mokungah and I'm still your host. With me here is Dr. Faleye, who has been giving us so much insight about lupus. So far, I have learned that lupus can present almost as anything. You could have like fever.
Yes.
And what would you say this is like for the patient or for you as the doctor?
Well, it's not easy for the patient and for the doctor to, I mentioned that high index of suspicion. That means the doctor must be able to think through. But what it is this, there are classical signs. There's something we call butterfly rash. Okay. If you open our medical school textbooks, but it's usually, we read international textbooks, so you will see pictures of Caucasians, not black pictures. So you will see it's around the cheeks. Yes, the butterfly rash is around the cheeks.
Like here?
Yeah, here and here. But, not all our patients will present with this. Anyone presenting with that to the consulting room, the doctor will, no, this is likely to be. But most of our patients will not present with that. Maybe when you have like 10 patients, maybe 3 or 4 are presenting with that one. What of the other 6 that are presenting with something, so weird? You don't really understand. You can't place it. So what I'm trying to say is that once you cannot place the symptoms,
you start
thinking about autoimmune disease, maybe likely lupus, especially when you have a female in the consulting room. If you are a girl and you are telling me you are losing your hair, I start to think. Or you tell me you do have sores in your mouth every time, I start to think. Or you tell me you have skin rash, that you've been to the dermatologist, severally, and the dermatologist does not have a clue about the rash. It may be lupus. It's not very interesting for the doctor to, you have to be able to.
Yes,
the patient too will be going up and down. Yes, and the problem we have in this environment is that by the time they present to us, they have been everywhere.
And told so much.
Yes. And by the time they now come, it may be late. Especially when you now have organ involvement. That makes us to have high mortality. You lose the patient most times when they present so late.
So there's a need for very early detection.
Yes. There's a need for early detection. And that's why I'm saying we need to know about it. When we all know. And I'm not even talking to those that are not health workers alone, even including health workers. Health workers may not be able to diagnose this disease.
Oh.
Yes, they may not, because most of us were not taught in the medical school. It was not part of the curriculum.
Why do you think it was not part of the curriculum? Maybe because
when I was in the medical school,
we didn't think it was in Nigeria.
Yes, when I was in the medical school, we didn't have a rheumatologist in my school. Some of my friends were lucky. They had maybe then we had just few adult rheumatologists, but we don't even have rheumatology as part of pediatric curriculum up till now. So most of the medical students may not even know that this can occur in children. They may even think maybe adults,
And when we were talking, I remember we were talking, before the interview started, we said you talked about being the only pediatric rheumatologist in Nigeria.
Yes. Well, that is a lot of work. We see quite a lot of patients.
And given that this, lupus is prevalent in children, how prevalent is it in children?
Well, let me just give you details about what is happening in Lagos. For the first 3 years, we reported 25 cases. But now we have data of almost 6 years. We have up to 60 children that have been diagnosed with lupus. I think that is quite high, because before I came up, the adult rheumatology unit reported 12 cases over 5 years. We invite them to the pediatric department to come and help us see children. That was before I started training with them. But being in the department now, there is high index of suspicion. Other units, they know that, this could be. So we now diagnose them early, we pick them early, and some other centers in Lagos, they are aware, they send patients to the clinic. And that is why I'm saying now that with the data we have, maybe if we want to report it now, we say we have 60 over 5 years compared to 12 that were recorded. That were reported over 5 years.
So we're getting better.
That means that if there's nobody to diagnose them, what is happening? If I'm talking about Lagos, what is happening in other states in Nigeria? Who is diagnosing those children that are there? You know, it's possible you keep treating them for infection, malaria. You may even think this is sickle cell, because some may come in and be, it's for transfusion all the time. You keep doing hemoglobin genotype, but they are hey or they are AS. They don't even have reason to be transfused all the time. So once it is not clear, think about autoimmune disease.
High index of suspicion.
Yes.
But at the end of the day, we've talked about somebody you treated that went on to become a nurse. There's hope. So what treatments are available for lupus?
Yes, we have medications. We have medications that we give them. We have some. I've forgotten to tell you that some of our patients present with musculoskeletal disorders like arthritis. Their joints can be swollen or they have painful joints. Arthritis in them is associated with early morning stiffness. Okay. These patients, they can't jump out of the bed early in the morning and start to walk, go to the kitchen. No, it takes some time. It may take 30 minutes to 1 hour before, to be able to come out and start walking and engage themselves, and they're always tired. So arthritis is one of them. So when it comes to treatment, you can make use of some of our pain relievers that we've got. Then we make use of what we call steroids. Mm-hmm. Then our major drugs are what we call disease-modifying anti-rheumatic drugs. They are immunosuppressives, Okay, they suppress the immune system.
Does that not make you susceptible to other diseases?
Yes, you are very right. To be honest, you look surprised.
You're fighting thing,
To be honest, lupus is like a war. A war for the doctor and for the patient. The patient is going through a lot. The doctor is going through a lot. Because by the time you start to treat them, you have suppressed their immune system. They are prone to more infections. So I'm not surprised if any of my patients present today with tuberculosis. Of course, I know that what I'm using to treat lupus has suppressed the immune system. If they come across anybody with chronic cough, they can have it. You can have lupus patients with recurrent sore throat, mumps. We can have lupus patients with what we call herpes, some fluid-filled rash all around their mouth, or some certain part of the body following a straight line. We have what we call herpes zoster, something like that. So they are immunosuppressed patients.
Oh. So are there any other complementary alternative therapies that may work, together with drugs that you are taking?
But there we have to be very careful. I know here people like herbal medications. What you are trying? Yes, agbo. People like we have to be careful. Though some come to the clinic, they talk about supplements. If it's just vitamins or minerals, we won't say they should not take it. But very important, they must not stop our medications. Okay. The medications that have been prescribed by the doctor must not be stopped. They can take vitamins, but we are not telling our patients to start all these alternative therapy, which have not gone through laboratory testing.
But do things like diet, exercise?
Yes, diet is good. Balanced diet. Balanced diet, avoid a high-calorie diet as much as possible, avoid saturated fat. Polyunsaturated is fine, fish oil, all these, yes, it's fine. Some have said omega-3 fatty acid is good, that is fine. But when we now come to herbal, real herbal, no, we are discouraging that because this has not been tested in the laboratory. And let me tell you, we have patients, they defaulted from clinic because of this herbal therapy. By the time they came back with worse symptoms more than they left us. To be honest, those that had just skin involvement, they now have kidney, heart involvement. Everybody's running helter-skelter. They have to land in the intensive care unit. Oh. So we have to be careful when it comes to all these Discuss with your doctor. If it's just a supplement, we may encourage. If it is not, no. Then do not stop our medications.
Okay.
Yeah.
So we've come through and learned a lot so far. Most importantly, that there is hope even in the midst of all of this, and learning that there are treatments, and even as there are treatments that can manage it, we should also be careful not to go and take what we shouldn't take.
Yes, you are not sure. Nobody has tested. It's not been validated. We don't know the efficacy of what they are taking. So that means you have to still follow what your doctor has told you.
This is truly so informative and very educative. I'm very sure that our audience have been educated and informed on this discussion so far on this very interesting topic. And because of that, I would like to encourage our audience to like, comment, share, subscribe, tell somebody to tell somebody about SYNLAB podcast. And stay tuned because we have even more upon everything, we have more for you. Thank you very much.